So we're here to just have a brief discussion about a subcomponent of the concept of leverage. So I've done a video in the past about lever, wedge, and screw and demonstrated it. And in that video, I very likely demonstrated the subcomponent, and then in subsequent videos I have as well. I just want to take a moment to kind of break this concept out and try to show it. I've showed it in some ways in the upper limb. I'm going to use the leg at this point just to try to give another visual example, explicitly break this concept out and show it such that it becomes a more manageable or more possibly manageable concept in assessment and treatment, because assessment can turn immediately into treatment, and the same movements that you would use to create assessment can be treatment motions. They're not always the same, sometimes they're distinct motions, but you may switch from assessment directly into treatment at any point. So we go from short leverage, or we begin with short leverage, the concept that the structure that you're attempting to interface with, your hand would be directly on it. So in the case of the quadriceps, right, should I be trying to work on the quadriceps, you can see my hands broadly contacting, so we talk about broad contact for multi-point discrimination. We also talk about contact as control, so we're able to do that. We can broadly mobilize the quadricep in relation to the femur. Now, in order to do that a little bit better, so I don't just have the whole leg shaking, right, because this is somewhat non-discriminate, then we use the concept of relational motion. So I can hold on to the limb a little bit lower, and I can mobilize the quadricep a little bit better in relation to the femur. So the short lever portion is here, right? The longer lever approach, right? So should I want to use a long lever to move the quadricep, and I think about relational motion, so one structure moves in relation to another, one thing stays still, the other moves in relation to it. What I can do is I can hold the muscle and move the bone. So my hand is just going a little bit lower on the leg below the camera shot, but I can move there, right? So that becomes, so there's a short lever approach here, I stabilize, and short lever approach. But in a semantic sense, because I've stabilized the leg at a lower point, what I'm essentially doing is using a mixed leverage approach. So if I, for semantics sake and for breaking this out, if I keep the leg still, the full leg still, or the full lower limb still, and I move the muscle in relation to the thigh or in relation to the femur, then I have a short lever approach. However, again, in a semantic sense, because I'm controlling the limb a little bit lower, the concept of contact control, I'm using some form of mixed lever approach because I'm creating control of that. If, again, this is where it gets somewhat semantically annoying. I say it out loud because there may be people who ask questions about this or attempt to have kind of detailed discussions where realistically, if you just zoom back out to the concepts of contact as control as well as relational motion, these semantic details are essentially contained within that. But if I hold this hand still and move the limb, we can call that a long lever approach to working on the quadricep perpendicular to soft tissue direction. If I do them both at the same time, so I kind of move both hands, I have a more accurate semantic application of mixed leverage. However, at all times, if I'm stabilizing the leg and moving the short lever, it's essentially a mixed lever approach. If I'm stabilizing the tissue and moving the bone underneath it, it's still a mixed leverage approach. Another way to attempt to show that is if we go to the back of the thigh, right? So I bring the patient's leg up in this situation because when we bend the knee, first of all, the hamstrings become, or the posterior thigh becomes more accessible, right? So it's essentially exposed, free to move in the planes required, and in this case, luckily it's visible, so that's a concept of patient positioning. But we're really speaking about this more with respect to leverage. So in this case, right, so you can see if I just use one hand, the patient's knee moves all over the place. So the short lever approach here becomes a bit of an interesting challenge because I have to stabilize. So less stable means I need to make the patient more stable. So as I remove a portion of the leg from contact with the table, I have to stabilize it. So my short lever approach, you can see my hand roll through here, perpendicular to soft tissue direction, I'm able to work in and around the hamstring. I'm able to mobilize the hamstring as a mass, as a general kind of group in relation to the femur. Now, that's the short lever approach, right? Again, the concept of the mixed leverage or the longer lever is the thigh itself, right? Or is the femur itself. So here, I hold on. And this is, the reason I do this is because when we go from short to long to mixed leverage, the semantics of it become important because I may be very, very close to the structures, so it doesn't look as long, right? The long lever doesn't look as long. So I'm holding on to the hamstring as a general group, or the hamstring group, or the muscle mass on the posterior thigh, and I hold this hand still. I can move this hand in relation to it. I can move this hand to move the femur in relation to the muscle. So that concept of relational motion. So I can go, the short lever approach would be considered here. Semantically, the long lever approach would be me moving the femur, right? So you could speak about essentially AD and abduction of the thigh, right? So the motion really is occurring at the hip, but because the hamstring is held, then I've got my long lever approach. Now, again, the semantics become very annoying because some individuals, some practitioners, as I speak to you, they'll mix up their terms. I just want to show this to you and walk through this in a more broken out fashion so that at least some discussion exists out there for clarity, for the explicit concept to be essentially examined. Right now, as an alternate, if I put my hand up here on the knee, some people would understand this better. It becomes a little bit awkward because to hold onto the hamstring, in this situation, for the sake of the camera, I would stay on this side so I can kind of grab underneath. My hand flips, right? More people would understand it if I work from the knee, so you can see my hand under here. If I work from the knee, right, or my hand on the knee, more people would automatically understand that as a longer lever approach because my hands are somewhat further apart and because I'm at the end of the femur, right? If I'm working from the middle of the femur, cognitively some may have a harder time understanding that as a long lever. Wherever my hand is along the lever is just essentially where I've grabbed the handle. So this is essentially a long lever approach to the hamstrings. Although most people, when they think a long lever approach to the hamstring, they would consider the leg straightened out and lifting, or essentially bending and straightening the knee with the hand on the tissue. Again, semantically, this is a short lever approach to the hamstring working perpendicular to soft tissue direction. This is a long lever approach because the idea is the hamstring stays still and the femur moves in relation to it, the femur being the long lever. So we take all of that, we sew in all of the other concepts to show that they apply in each situation. But again, often in assessment, right? So this is assessment of the hamstring. So the hamstring likes to go that way, doesn't like to come this way. So the assessment can immediately turn into the treatment. So that's a short lever assessment. If I just hold there, that's your myofascial release. If I move the leg, some people would call this oscillation, some people would call it articulation. Some people, when they use the word articulation, they immediately think of joint mobilization. That's the analog in their head. Articulation really is essentially the how things are relating to one another. So a word is articulating a thought, so the word relates to the thought. Right? That may not be the most eloquent way to explain it, but hopefully the picture gets across that I'm articulating the hamstring in relation to the femur. So relational motion could also be called an articulative or an articulation concept. Right? So this is a long lever approach. This is a short lever assessment, long lever approach to myofascial release if I hold it. Articulation, oscillation. There's all these words that become interchangeable and very confusing. One of the reasons that I go about breaking these conversations out and having these larger concepts is to attempt to sew them all together so that you hear the words that you're used to, you see them in action, and then we pair that with other words that you may not be as used to. So hopefully that just takes a moment, uses a bunch of words and some visuals to help you understand the concept of how long levers, short levers, and mixed leverage all sew together. And often they sew together really under the broader concept, as at least I speak about it, of contact as control and control as safety, broad contact for multi-point discrimination, which is more assessment and palpation, but then also relational motion. So all lever approaches really are well described by the concept of relational motion.